come here to have my teeth cleaned, and at the same time, I can have the BOTOX procedures by Dr. Patel.
Little fine wrinkles that are starting to show up. Primarily, most patients will see them just across their forehead, around the upper eye area, the 1s, 11s, the 3 ones in between the eyes, crow's feet, down here by the lips when they kind of pucker up. You can see little lines up there. A lot of my female patients will have concerns that when they do that, or if they drink through a straw, they can see their makeup kind of running into those little lines of the lips.
Another reason why I come to Serenity Dental to Dr. Patel to do Botox in Finland is because he's part of the American Academy of Facial Aesthetics. And that's an organization that just adds confidence, to the procedures.
You might feel a tiny little pinch, but what doesn't hurt is the actual needle itself, because the types of needles that we use in our office are ComfortTox needles. They used to use insulin needles, which are very fine needles. They don't really hurt, but now we use a different type, which are called ComfortTox. They're triple beveled, super sharp needles, that's what they call them. Very fine. You put them in really quickly, in and out very quick. No, none of our patients really complain of any discomfort with them at all.
Dr. Patel is a very good dentist, a very soft hands. So when he does the Botox procedures, he has the same quality on his hands, and is very gentle, and you hardly feel the needle on your face when he's doing Botox.
So we have Sinara back again. We're going to be doing Botox treatment on her, or botulinum toxin treatment. With botulinum, we always call it botulinum rather than Botox. Botox is the name brand. In our office, we use Botox and Xeomin, both similar products, but on her case today, we are going to be using Botox. So normally I wouldn't put these little dots, but if you kind of take a look right over here, we can see that I did put these outlines just so viewers can see where we're actually been placing them. Normally we don't place them because we know exactly where everything's going to go. We've got a diagram of a picture diagram on the table where everything's going to go. But this kind of gives you an idea. So she's going to get about 50 units of Botox. She's had this done before. We're going to be putting more on the forehead area. So if you kind of squeeze your forehead up a little bit, we can just see these fine lines. She really doesn't have that deep lines, but we can still see them up on the upper 2/3 of the forehead area. Then if you kind of squeeze her eyes together, you can see how these muscles together are squeezing, causing these little vertical lines over here, and everybody talks about the lines right in between the eyes. Same on this side, she's got these little vertical lines here. Her eyes, you can see she's got some lines starting to develop on the side over here, and then also her lips right into this area. You can see just a few little lines over here. Now with the lip area, you can go and close up. We just did her fillers a little while ago. So we don't want to put a lot of Botox in the lip area, because what happens then is she's not going to be able to smile anymore. So just enough, just to kind of get rid of those little fine lines. So with the Botox treatment, it happens pretty easy, very quick and easy. I have all of her Botox needles already set up, ready to go, so it's going to be very quick. As I said, she's had it done before, so she knows exactly what this feels like. It's very quick, very easy. You don't feel any of this at all. It's just a tiny little pinch, a smallest little pinch that you feel. So we're going to actually start off with the forehead area first, and we're going to just start giving these Botox injections here.
It doesn't hurt, you just feel a little pinch.
Little pinch, yep. It's really not too bad. Put a little bit on this outer edge here. And with Botox, you will notice that it does welt up just a little bit. And let me just put one more in the center here. That's it. Perfect, good. So it does welt up just a little bit. And we're just going to push this towards the top because we don't want it to go to the bottom. And once we're all done, we'll kind of clean all of this markings away as well. Mm-hmm. These welts, they last about an hour to 2. It's not really that long. Was that about how long it lasted last time when you had it done?
Yes,
about a couple hours or so? Even less than that?
Yes.
Yeah, it doesn't really last too long at all, just about a couple hours. Mm-hmm. Now with Botox, you don't notice the difference immediately like you did with the fillers. This takes about 2 weeks to really set in. All right, so now we're going to go to the areas kind of around above the eyes. So kind of right over here, we're going to do here. So we're going to put 6 units on this big muscle here on either side, so 6 on the front, 6 on the back. So we're going to grab this just like this because we want to make sure we push all this up. That's it, and we just kind of squeeze it upwards a little bit. And I'm going to do the same exact thing on the left-hand side. So as you can see, these Botox treatments, they go really fast. The good thing about this is a lot of our patients, when they come in for simple procedures, cleanings and things like that, and if they decide they want to get Botox done, we've got plenty of time to do it because they're very quick. We're almost doing her entire facial area, and if I was not explaining and things like that, so we can pretty much finish this up within about 5 minutes. It's a very, very quick procedure to do. And now we're going to go right in between the eyes, right over here where we get those, sometimes the people call them the 11s, where you get the 2 lines that, that meet up in the center. So this is a pretty thick muscle, so we're going to put it right into the center here. That's it. All right, and now we are going to go around the eyes. Everything okay there?
Yes, I just feel a little pinch.
A little bit, yep. Okay, I'm going to come back and do the other side in just a bit here. So we're going to go into the lips here. And then we'll come back and do the eye on this side. Okay, good. So again, just slight amount of bleeding. Nothing compared to the fillers. A little bit of welting there, but as we said, this welting is all going to go away. Let's see if I can just get some alcohol and I can kind of wipe that off for you. With Botox and fillers, the main thing is that some patients, they want to try to get rid of this swelling. They might put some pressure and things. You don't want to put any pressure. You don't want to touch it. Don't do anything at all. As you can see, when we're wiping all of this up, we're actually just wiping it upwards, away from areas that we don't want it to affect. Again, the way that Botox works is we're just kind of putting these muscles asleep so that way they don't contract as much. So if we have patients who push it the wrong way, you may push it towards the eyelid and places like that, and then you won't be able to use some of the eye motions. So we just want to kind of stay away from it. Don't touch it at all for at least about 2 days. Same with the lips. Don't use the lips around too much for about a couple of days, straws and things like that, and kissing and things like that, because it will move around the implanted filler or even the Botox itself. So really nothing to do. Like I said, and Senora also said that these welts will go away very, very fast. Within an hour, usually it's gone. 2 hours usually max, but she said even less than an hour, hers are usually gone. So you can notice a little bit of redness and everywhere, but that's all going to go away as well. How's everything feel there?
Yes, everything
Good?
feels good. Yes.
All right, so as we said, Botox treatment, 50 units, pretty much all around the entire face, forehead, in between the eyes, above the eyes, around the sides of the eyes, and on the lips. All this in total, if we were to do it without any type of explanations and things, will be done within about 3 to 5 minutes.